Okay, we'll go ahead and call the meeting to order. Let's do a roll call to start out.
Director Leach.
Here.
Director Jeffries, present. Director Stanisek.
Here.
Director Morales. Here. Director Brown.
Here.
Oh, thank you. We have quorum.
Awesome. Let's start with the pledge. Ready? Begin.
I pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation under God, indivisible, with liberty and justice.
Good to see you. Can I have a motion to approve the agenda?
I'll make the motion.
Second. Any discussion?
Director Leach.
Aye.
Director Jeffries. Aye. Director Stanisek.
Aye.
Director Morales. Aye. Director Brown.
Aye.
Thank you.
At this time, we'll open it up for public comments. I have one card here for Ross Pike. You can go ahead and stand up and talk, sir, and if there's anybody else that would like to make any comments, you go ahead and make them after he talks.
I just wanted to say thank you for your support for my campaign for LAFCO, and I look forward to continuing to work with you as a friend and director on North Bend Fire. So thank you. Thank you.
Good luck. Thanks a lot. Does anybody else in attendance?
Sir. Joe Byer, live in Bonneville, right by Bonneville Elementary School. That's where I get my good education. So I've got 5 bullets. Number 1, real quick, 5 bullets. Number 1, just keep up the super classes at the center. You're doing English, and as much as possible, you're doing the Spanish. Even if the Spanish attendance is small right now, it will grow. So that's very, very fantastic that you're trying to do the Spanish and English. You have the English class going, and then usually right after you have the Spanish class, or you can end up reversing it sometimes. Sometimes Spanish first, English second. Okay, number 2, the monthly event calendar on the email is just great information. Just keep that going. I really apologize for not going to the May due to poor scheduling on my part to input and keep that sort of thing going on, because that's great that you're reaching out to the public. Hey, tell us what we're doing right so we don't change it, but then tell us what we're doing wrong so maybe we can work on it. It's not a perfect world yet. Number 3, the center team is absolutely fantastic. I was telling the director here that Darlene that just every space there is filled with information. You go up to a blackboard, not a screen like this, but everything is up. It's organized. It's beautiful. It said what our mission is, what we're trying to do. Very, very impressive the center. I went there on a class or so and just was very, very impressed. Then number 4, bullet item of 5 is the Fallbrook Urgent Care Center on Main Street. Keep that support going as much as possible. Everybody, not everybody, but folks, I'm sure want expanded hours and all of that. And if that's possible, it just requires money. Yeah, and we all need certainly more money. And then the last one, the 5th bullet item, is just maybe periodically to move the meeting, this wonderful meeting that goes on here, and move it occasionally down to the center, which may draw some people that don't normally go to the center, that they go there. So, but logistically, I'm sure it's very, very hard, and it's been a tradition that it's always been here and in this room. But you may consider that, because the future is the center. Thanks very much, and keep up the great work. Hoorah!
Thank you, Joe.
Thank you.
At this time, I'd also just point out to the audience as well, the staff was able to get all of our meetings up on YouTube. So if you happen to miss a meeting, or there's something you want to go back and take a look at, I have a lot of the recordings up right now. So
That's a great
never
accomplishment.
miss one.
Very, very good.
Sir, would anybody else in the audience like to make any comments? Any on the Zoom? Okay, seeing none. We'll go ahead and close public comments. Moving on, do we have a presentation?
Actually, we just got notice that, Shay is not able to present tonight, so we will have to reschedule their presentation for a future date.
Okay. Right. No worries. Moving on to consent items. Would anybody like to pull any of the items? No? Can I have a motion to approve the consent items?
I so move.
Second. Any discussion?
Director Morant. Aye. Director Stanisik.
Aye.
Director Jeffries.
Aye.
Director Leach.
Aye.
Director Brown.
Aye.
Thank you.
Moving on to reports, Finance Committee, Director Brown and Jeffries.
Okay, I'll go ahead and read the Finance Committee report for the month of April. Can you hear me okay?
Yes.
Yeah, we can. Clear.
Report number 1, balance sheet comparison of April to March. Total liabilities and equity for April, $12,444,830. Total liabilities and equity for the month of March, $12,367,032. This reflects a month-to-month increase of $78,798.20. Report number 2, the income statement. Total net income for the month of April is a positive $74,364.88. That's positive to plan. This is due in large part to the smaller than expected property tax apportionment because that was higher budgeted, but we are still positive. Report number 3, profit and loss actual versus budget. Based on the approved budget operating plan, the district is over budget in year-to-date net income by $432,974. Report number 4, the approved annual budget or operating plan for 2022-23. There are no changes to the operating plan. Report number 5, the LAIF account statement. LAIF posted $11,187.78 in quarterly interest earned. The cost value is $2,495,928. The fair market value of $2,462,257. The performance rate for the month of April was 2.87%. Report number 6, account statement. The cost basis, the average cost amount for this account is $5,815,481. The district earned $14,689.12 in dividend income this month and an unrealized gain of $5,785.12, bringing the portfolio's total to $5,678,326.21. As of April 23, the 1-year yield on the medium fund where these funds are allocated was 2.15%. Report 7, property tax revenue. The district accrued a tax of 75 cents for April. Report number 8, the check report. Details the operating accounts, deposits, and disbursements for the district for April. The committee reviewed these transactions with staff, and we did not find anything that was extraordinary or uncommon. Report number 9, this report was charges using district credit for the month of April. Again, the committee reviewed these transactions with staff and didn't find any outstanding issues. Report 10, the Community Investment Funds report April. This report shows utilized funds invested in the district's real estate, primarily for the redevelopment of the Community Health and Wellness Center, including maintenance, repairs, permits, and consultants. For the fourth quarter, there was $71,300.72 spent. Part of our disclosures, the investments of the district are in compliance with investment policy. The balances in the district give the district the ability to meet its expenditures requirements for the next months at least. And that's the report.
Exterior. Does anybody have any questions on that report? No? Good.
Sorry, just, I do have actually a quick one. Is there a normal process for highlighting unplanned or an expense that is kind of out of the window of normal tolerance? And these types of things that what the finance committee will bring forward and say, hey, there's a couple things that popped up that were kind of unplanned or unexpectedly large, and then you'll highlight those as part of this. So, and I heard there was none, so that's good.
Yeah.
Okay.
Right. Yes, the facilities committee would red flag.
Yeah. Good, thank you.
That's
just the.
Okay.
Yeah.
Moving on to facilities, Jennifer.
Yes, our May 17th meeting, Barbara and I received lots of information. We'll start with the education building, classroom area. The, what we call cosmetic projects have been completed in the ed building, the painting, the flooring, the cabinetry, and the classrooms that are being used. The exterior painting and gutters at May 17 were in the bid process. I don't know whether it's proceeded from
It's
there.
halfway finished with the painting now. The exterior shade structure was painted today with its first coat, and half the education building has been painted as of today.
Beautiful. We also discussed the need for gutters. And those will be also taken care of, and Barbara and I have recommended that they have this screen on top so that we aren't constantly getting people on ladders to get their leaves out. So the ed building's coming along quite well. The second piece of the property, the House of Wellness, we're still involved with the ADA compliance component that holds that whole center in gravity in order. We've got the patio, we've got the bathroom that needs to be ADA, we've got the entryway that needs to be modified. So there's thinking and planning in that area, but we're not quite ready to do anything until
Ya,
facilities brings a recommendation. So
y esperamos recibir recomendaciones con respecto a esto.
the parking lot reservation
Con respecto al espacio de reservas, tenemos muchas cosas en ese campus, así que tenemos que hablar sobre los paneles solares, sobre la luz. Es un proceso que lleva tiempo y luego van a poder avanzar en este proyecto. Y creo que eso es todo de mi lado. Seguramente lo vamos a continuar. Creo que vamos a tener más datos y vamos a continuarlo. Bien, y también vamos a ver lo de la presentación. Creo que tenemos un plan estratégico y en la última reunión hemos hablado sobre esto en la última. Sí, me
because I just can't recall everything.
So much going on, huh?
I'll recap for you, Barbara.
Yes,
and
if you
Phil. We discussed and did an overview of the proposals put forward from the Gary and Mary West PACE program. So that is pending a tour. I have followed up with them and asked them for that next level of details. The initial conversation was we liked the concept, but we wanted a little more detail around what services would they be able to provide and what type of scheduling. So I'm waiting for those details to come back. The second one was a review of Palomar Family Counseling. That proposal is in tonight's packet. That was the majority of what we spoke about. We talked a little bit about the site logic, which is the overall parking lot, solar. That was discussed. Obviously, that was moved, so we'll hear about that again. But that was the majority of the things we spoke about.
Did we have any follow-up on the idea of having a tower?
I am pending them coming back to us on that. And so that'll come back to facilities as soon as they give us any other information.
Okay.
Thank
And
you.
that's about it.
Yep. And obviously, we had the strategic planning workshop last month as well, and a lot of the discussion and action items that we have tonight basically originated from that discussion. So next up, we have governmental and public engagement, Director Stansted.
Yeah, last month we did not have the meeting, decided to slow down just a tad until we do get to the strategic planning and objectives that fall from that. And then develop the communication strategies based on that. We had, Doe did have a workshop yesterday to talk through some ideas with a new community outreach person, so a communications person. So we're good to see a person on board to help us there. Good discussion, a lot of ideas, lots of things to do. So I'm encouraged by that.
Awesome.
Yep.
Teresa.
Oh, thanks.
Perfect
Well,
timing.
Well, I thought things would slow down a little bit over the summer, but not that much. So June has scheduled a total of 93 events at the Community Health and Wellness Center. So 27 are private and public are 66. So we're busy. So we are doing at the end of the month on June 28th, our Narcan 101 workshop. It's going to be combined with CPR, because if someone was unresponsive to the dose of Narcan, that's the time that you would start CPR. So, you know, if that wasn't the issue at hand. So we do have that. Mary Murphy is going to do the education portion of that. We have a partner from the county where when community members and our partners through the CCHW come to the training, then they can receive a dose of Narcan through this partner. So we will be getting that out into the community. We're still working on some other partners to be at the meeting for maybe, you know, some support services in terms of drug, addiction and different resources for parents and things like that to kind of round out the event. So that is still in the works, but so far we have close to 30 people that have registered for it. Wow. So, and of course you can show up too, but we, like to do the registrations. So the other new program that's new-ish is our lifestyle change program. That's continuing to go great. Attendance is very important to maintain a high level of attendance in that program. And we are still averaging about 19 participants each week. And usually there's like 20 or 21 in the program. So people are very excited about that. We've been working really hard to capture a lot of data at the beginning, because the plan is to work together with Skinny Jeans, who's part of the Jane Moss Foundation, to be used as a study. So the CDC and other, organizations are very interested in how do you take this DPP program and instead of just having a physician offer it, having a community-based organization, such as ourselves, bring it forth to the public. So that's kind of exciting to see what will come at the end of this year, but we're doing all the hard work now of collecting all the test results, which are, secured, in regards to HIPAA, but we'll have that information all ready to look at the end. So that is going strong. Our community resource navigator is definitely getting her feet wet. She's had over 30 clients to date in her first 4 months. So, and that I'm sure will only continue to grow now that we've really put her out there. We had the press release that went out about her. So some of in terms of new programming, what's happening there, this summer, we're starting a new campaign with North County Fire. They do more, just public service announcements about pool safety, but we're actually going to partner with them to do a pool safety and CPR class. And because that's another instance, unfortunately, where CPR can be very, very helpful is in the case of a drowning. So the participants in that class will receive a water watcher lanyard, kind of a cool thing. If you're having a party, whatever adults watching the kids gets this lanyard. And so it kind of promotes the pool safety portion of that. So some other things that are going on is we have Palomar Family Counseling Service returning with a program, the Setting Boundaries support group. That's continuing. We're in the midst of working on an MOU with Scripps Whittier Diabetes Center for them to offer that diabetes self-management portion of our diabetes program. So we go from preventing diabetes to assisting people who actively have diabetes, and that kind of really rounds that out. The food pantries, Nutrition to Grow On program is returning again this summer. And that's a collaboration also with Boys and Girls Club and Fallbrook Garden Club as well. So I guess the last piece of news in terms of what's happening there is that we have started extended hours. So on Tuesday nights, we are staffed until 7:30. So next week will be our first pretty full event schedule with things happening, and we're looking to build up programming on those Tuesday nights. So now if there's an activity there, we're really pushing all those to the Tuesday evenings. And then eventually, appointment by appointment, our community resource navigator would be available, but and available by phone. So that's kind of nice for working people to get a hold of her. So then in terms of how many visits we had to the center, it was 939 in May. So it's continuing to go strong. We had 5 private classes held there in that month, and we're continuing to serve our grantees. And so 16 of the events that happened were directly for our grantees, in addition to the developed place office hours. So the rest of it, you kind of seen before. We do the flyers. We're continuing with our email marketing is going strong. Social media, if you scroll to the social media, the last page 3, I put there's yeah, that's good. We're making reaching out to the Spanish speaking community. And so I wanted to show you an example. If you scroll to the next page. Oh, yeah, you can see some, you keep scrolling, you can see some examples of some of the posts that we're putting on the Spanish Facebook groups, all in Spanish, to reach that audience. And we're excited. This happens to be about mental health first aid. We will be offering that entirely in Spanish in July. We've gotten a nice interest list there. And then if you scroll down, the other thing we're seeing good responses on our posts like this with CERT, where we use some of the tools on Instagram to, in that it's a collaborative event, to gain more viewers.
Yeah.
That's me.
Awesome. Well, thank you. Yeah, that was a great report. I appreciate it. Any questions?
Just one. I may have asked this before, but it just hit me again. Do we get any geotagging from the social media people that do hit us? Are we able to map out a little bit where they're coming from? Okay.
Yeah,
I'll
we
check in
do.
later.
yeah,
See what else-
yeah. And we're starting to look at like what time of day to, make sure we're, putting our posts out when people are most active and that
I'm
next.
kind of
stuff.
curious about the district map, how that
Yeah.
might lay out in terms of response, and
Yeah.
who's hitting this.
I can put that in next time.
Okay, thanks.
Or we can
public
just add it
engagement.
to the
Yeah.
committee.
And refresh me, 900 and what visits?
39.
939.
Yeah.
Still going.
Bill,
Yeah,
now,
That's right.
the last 3 months have been over 900.
That's great.
Barbara, do you have anything?
I'm just excited. I am just so excited to see this come to life. From where we were to where we are now and to where we're going. It's just a wonderful vision, and it's nice to see it coming to life.
Good job with the team. Well done.
Just a question for me, when you get the registrations, are they able to just go on the website and just register from the calendar? Is that how they do it? Just click on the event and then they can
On our-
register?
Yeah, so on our website page, there's 2 ways. There's on the actual calendar for that date,
Mhm.
and then also under our workshop page on the website. We have flyers out there. It's an event on Facebook as well. So there's a couple of different points of entry.
Awesome. That's it for me. I appreciate it. It was a good report. It's great to see, you know, all the people out there. I actually drove past on Tuesday and saw the car and so
Yeah,
it's great. Yeah, absolutely.
Are we missing a party?
yeah. It's not at all. What's going on in there? Yeah, it's really good.
For sure. Okay, the CEO's report, Rachel.
All right, again, most of it's already been covered, which is awesome. So Site Logic will be meeting with the facilities team to go a little bit more in detail over their letter of agreement that they've sent to us. Once facilities has had the opportunity to look through that letter of agreement, they'll decide whether or not to take it to the July board meeting. Expectation is we'll probably see a full presentation on their offerings in July. Education building, as I mentioned, the shade structure and the building are in process of being painted right now. The parking lot will be restriped this weekend. So Roy, I took one of your vendors, was able to get a relatively inexpensive price to restripe it. We know it will not be perfect. We know it won't last forever, but that should last us through the summer, or at least until the next step in the parking lot's redevelopment is determined from the district. So that should be done this weekend. I just got confirmation from them. They'll be there. Again, it needs to be done when no one's gonna be driving on it. That's getting harder and harder to find a time to do. Again, waiting for more information on the communications tower information. The July board meeting just happens to be out at the Community Health and Wellness Center next month. That will also be our first grant check distribution for fiscal year 23-24. We anticipate that all the grantees will show up. So we're making, well, there's a mandatory meeting right before the board meeting, so I'm pretty sure they're all gonna show up. But we'll also do the check presentation. We have the big check to be able to distribute. So we'll be able to do some photo opportunities, be able to provide that out, get some storytelling that we can build in about what all the grantees do. So again, that's an important piece to do. That will be held at Building A, which is the largest of the buildings on the site. And I'll let you figure out which building that is, but that is now Building A. Education building is now Building B. And the house is Building C. We like to actually stay with the alphabet, Mike. It's a little.
Mix it up, make people guess, look around, find something.
Yeah, no, things are right enough in life as it is. Let's keep it simple. All right. Administrative projects. So once again, thank you, Raquel. We were able to finalize and get our ACHD certified health district in. We're only one of 17 in California that hold that distinction out of the 76 healthcare hospital districts in the state. So
Nice.
we're very proud of the work that does. It shows the good governance and core set of accountability and transparency standards. So we've had that now for, I think this will be our third full set, which I think is which would cover 9 years. So we're excited to have that back. Jasmine Thomas was hired as our new outreach and communications coordinator. She started with us on June 5th. She already had an opportunity to meet with Director Stamsek and the team to start working on that communications strategy. So that, and we'll go back to governmental and public engagement, and we'll work closely with strategic planning to make sure that we're consistent on the messaging and some of the plans that we are putting forward. So we're excited to have Jasmine with us. Still working on the updated policy manual. I'm working with Jeff to make sure we've got all of that current. It's a big project, so we'll bring out probably large sections of policies. What we're doing is we're looking at a lot of the CSDA template policies so that we don't have to reinvent the wheel, but we will personalize them for the district. We'll probably bring those out in groups. So for example, if group 1000 is considered the governance policies, we'll probably bring those all forward. We'll put them into the board portal, give you enough time to review them, red line versus current. And then it'll probably fall into consent, just because otherwise you're gonna have 5,000 pieces of paper. But the idea is if there's anything that's truly unique or different or substantively different from before, we'll probably have those outlined in advance. So that will be a big project that you'll see us continuing for the rest of this year. Okay. Mission, vision, values, we'll be talking about that a little bit later today. Ongoing grant protocols and procedures. This process will move to committees for expanded conversation, specifically to talk about the grant to revenue proportion as we go forward. That will fall into the finance committee. And expectations of service provision, that will fall under strategic planning. So that's being a little bit different from how it has fallen in the past, because there's a different focus on it, a little more in-depth to make sure it's more current. And then we will continue to have conversations regarding regular partnered programming from grants to MOUs. That'll live in strategic planning, and that's for those kinds of services that are a little bit different and take a little bit more in-depth commitment. Michelle's Place, Palomar Family Counseling, and the Foundation for Senior Care are all three groups that we're having some level of consideration with. I had a meeting with the St. Paul's PACE and Palomar Health Medical Group regarding potential expansion of clinical services in the area. So just a reminder, I am still following up on those conversations. I'll bring them forward once we have a little bit more of a conversation, a little more meat. Right now, it's still very exploratory and theoretical, if you will. Getting details regarding services and the rotation schedule from Gary and Mary West, as I discussed. We'll bring that back to strategic planning once we have more of those details around their schedule and exactly what services would they bring, so that we have a little better idea of what 8 hours of care actually looks like, whether it's just access to telemedicine or whether what provision and what services they'll have on a daily basis. Board education and conferences. I've sent an email to all of the board, specifically asking you to look at your calendars regarding the CSDA annual meeting in Monterey from August 23rd to the 31st. I got your response, Bill. Thank you for that. Bill's response is in.
What a brown noser.
Oh, yeah. Geez, you're gonna let football talk, man.
Somebody's getting tripped on their way out. And then September 13th to the 15th is ACHD. Mike, you and Terry, I really strongly suggest, if possible, going to CSDA. As newer board members, it's really the best training you can get in how to be a good board member and to understand roles, relevance, best practices in governance. ACHD is really ideal for board members with more experience or who have much more interest in the health sphere. Since it's just other health and hospital districts, it really gives you more in-depth comparison to what other groups are able to do. So we'll be divvying that up between board and staff this year because there's so many new all around us. This is really a time to make sure everybody is fully educated and trained on these processes. So
And CSDA was in August.
CSDA is August 23rd through 31. Okay, so Mike, I'm gonna put you in on that one. Terry, I'm gonna bother you when you get a chance to look at your schedule, because I really want to get our registration in. There is a discount if you do your group registration earlier, so we want to make sure we get that.
Okay, fair enough. I'll get my, within the next week.
Thank you, Terry, I appreciate that.
You bet.
And then lastly, which I didn't have on the board report because it just showed up today, we finally received the physical check from San Diego County for our community enhancement ARPA grant fund, reimbursing the district for much of our COVID expenditures. So today the district was able to recoup $96,827.
Yay.
So that will go back into the district's coffers to support programming and different things. And however the district plans to use those funds, but it reimburses us for a great deal of those expenses we put forward. So we're excited to have that finally come in during this fiscal year. And that's it for me.
Awesome. Thank you for your report. Any questions?
Good job. Thank you.
No- no
I'm
questions?
glad.
Good.
I would just second what Rachel mentioned about the trainings. I would recommend it for any of the board, definitely good for the staff. For sure, I know as a board member, I learned a lot going to some of the early meetings and not just some of the roles and responsibilities for boards, but not only that, but to get ideas from other districts and see what other districts are doing out there. It's definitely invaluable. So definitely hope to see some of us out there and get a lot of learning out there. So moving on, we'll go to the general counsel's report. Jeff? Down there, Jeff?
He's right there. You have to unmute yourself. There you go.
Thanks.
There you go.
Thanks, Bill. I just wanted to echo what you and Rachel just mentioned about how important it is that board members get the opportunity to go to these conferences. I really think they're really helpful and help your education. So I have no formal report this evening. I would like to mention, though, that the cutoff date for bills to be submitted has passed in the state legislature. And I should have a review of bills of interest next month for you.
Okay, thanks a lot. I appreciate it. Move on to discussion and possible action items. G1 is a set of recommendations from finance. Terry, would you like to present that?
Absolutely. So during the finance committee meeting, in an effort to manage our Pacific Western account within insurance limits and to take advantage of some of the interest rates from some other venues, would like to ask the board to consider GI, double I, and triple I, 1, 2, and 3. So, Rachel, I'm gonna let you go ahead if you would, and just explain how we came up with the amounts that we're proposing for Five Star Bank and for Pacific Western.
Sure. So as you may recall, the last couple of months when there was so much extraordinary banking activity nationwide, we reviewed all of our accounts. We moved a considerable amount of funds out of Pacific Western and over to our Lake account. That prompted us to decide to open the Five Star banking account, which allows us to have 2 checking accounts. Pacific Western would stay our basic operating account, but on those months when property taxes come in and it pushes us beyond our insurance limits, we'd be able to transfer those funds over to Five Star. And consequently, on those months of the year property taxes are lower, and those are months that we're also providing grant checks out, what happens is we have a decrease in the Pacific Western amount, and we've had to go to the investment accounts to feed that. Obviously, we would prefer not to upset those investment balances, so this would allow us to keep a little bit more of an even keel, but not allow such a giant bank account that it falls outside of those insurance limits. So we looked at our regular monthly expenditures, including the next couple of months, which we anticipate is usually low in property taxes, but high in expenses because we have our first set of grant distributions. So in doing that math and ideally trying to figure out what's the best way to fund and balance our expectations over the next couple of months, the recommendation is to move 250 from Lake to fund the Five Star bank account, and to move 500,000 from Lake to put back into Pacific Western. That money, although it would be above the insurance limit, would only be in there for a hot minute, because we're about to write out half of that essentially in grant checks. So that would put both of those accounts into a strong liquid position, which we're going to want for the start of the fiscal year. And then the third account, Terry, that is the investment account. If you want, do you want me to continue with that one?
Let's hold off the discussion for item 3 a minute. Let's go ahead and I'd like to ask someone to make a motion to approve G1 and G2 as we, and then we'll have a discussion with regard to funding the class investment account. So
Okay.
Bill, if you would ask
I
him for a
think,
motion.
Absolutely. I think we have one from Barbara. Do we have a second?
Yeah, I second.
Okay. Any discussion on that?
Makes sense.
Yeah, I absolutely agree. Let's go ahead and vote.
Director Leach,
Aye.
Director Jeffrey.
Aye.
Director Stansett.
Aye.
Director Maraz.
Aye.
Director Brown.
Aye.
Thank you.
Just for clarification, this is a one-time,
Yeah, this, because 5 Star is a brand new account, we already voted to open the account. That process has been completed. This is to actually fund that new account. So it would be the one-time expectation that we would take those funds out of LAIF that we put in a couple months ago and then use that to fund these 2 accounts.
thank you.
Terry, would you like to present on the next one?
You betcha. So now the question is with regard to our large amount of cash that we have in our LAIF account, we have an opportunity to put a large part of that, if we'd like to, into the class account. I'm going to let Rachel tell you about the class account, but essentially leaving some in LAIF, which is my suggestion and my request, but putting a significant amount over into the class account. So Rachel, if you can tell us about the class investment account.
Sure. And again, as a reminder, we have already voted, you all as a board have already voted to open this account. So we've opened this account, so this would fund it. California Class is another investment tool like CalTrust and or LAIF, all the exact same safeguards, but it's a new vehicle that's being put forward so that there are more options in the market. They are newer. CSDA and a number of the different special districts have been supportive of this. Many have joined. Right now, California Class, because it is a newer vehicle, happens to be just lucky that they opened when they did according to market. So their return rate is about double LAIF's return rate. And part of that has to do with treasury bonds, right? Yeah. The timing in which they mature, because theirs are short term, they've been able to really benefit from these rate hikes of interest rates. Whereas LAIF and CalTrust have longer maturities, and so their return rates are much lower. The expectation and the information that we received when we met with Bob Schull from California Class is the expectation is that California Class will continue to see these types of returns for likely another year. Now, he shook his magic 8-ball and said you can't guarantee it, but the expectation is from all of their investment advisors that that would support that. So that was something that we discussed in finance. The question became to what extent and what level were you comfortable with funding that? And then Terry, I'll kick that back to you.
Yep, fair enough. Well said. So the question for the board is how comfortable do you feel in putting our remaining $2.5 million after we make the transfers from item 1 and 2 from the LAIF account into the new class investment account? My personal feeling is that I'm uncomfortable in transferring anything more than half out of the LAIF account, and I'm suggesting something closer to $1 million, which if all the safeguards are in place, that's all fine and dandy, but we're not in the earning money. Certainly we need to be responsible. I get that, but we're in the business of providing health services to our constituents. And we have a comfort level, at least I do, with LAIF. It's been around for a while. Class is new. Yeah, it's got some protections, but are you comfortable in taking all of our money out of the LAIF or a very large amount, putting into class, or would you rather just kind of balance between the two, a suggestion. So I leave it to you guys to consider that thought, and then let's have a motion to put some money in there.
I appreciate it. Let's have some discussion. Jennifer?
Hi Terry. Can't see you, but I can hear you. Did I understand you to say that you would be comfortable with approximately $1 million out of the lake going to class?
Yeah, since our meeting at the finance committee, I'm feeling a little more comfortable. Certainly $1 million is a large, but it's not. It's less than half of what we will have in lake. So
Right.
that's my.
Okay, I would align myself with that. I feel comfortable with that amount, and it can test the waters. We can see if the 5% is a goodly thing, and I feel comfortable with that.
Yes, I would agree with you. We could always increase as time goes on if we find it a viable alternative. I'm interested to see what kind of outcome it would have for at least 6 months. See what it does, and then we could, augment our finances after that.
Do we have any public comments on this item? Anything here?
Could you tell me who's the overseer on these accounts like you have with Lake? You have involvement with BlackRock and
So Barbara, I anticipated your question.
I'm just doing my due diligence, asking.
And because I knew you would be, I also did mine. So I reached back out to Bob Scholl, who is our primary contact with California Class. They have had no involvement with BlackRock, and they do not expect that they would bring that forward. Just in case you hadn't been reading all the emails you get from CalTrust. CalTrust has also disconnected from BlackRock just for lots of various reasons. But there, again, the safeguards are all in place. But most of these investment advisors are the same groups that work with a lot of these municipal pooled investment accounts. So there's really nothing new. But we did want to make sure that we looked into that, because I know that has been a concern of yours over other accounts.
Thank you. I'm good with this. This is a good idea.
Okay. Well, I'd go ahead and make a motion then to transfer the $1 million into the class account. Can I have a second on that?
I'll say.
Any discussion?
Good idea.
Out of the LAIF account to go into class.
Correct.
So you
Correct.
might want to add verbiage on your
Sure.
motion.
Sorry about that. Yeah. To transfer $1 million from LAIF into the Cal Class investment account. Good. And then, yeah, just a final discussion point. I would just say it seems like a sound policy. If we could take advantage of a little bit higher interest rate, I mean, it seems like it makes sense, and it doesn't hurt for us to have a little bit of extra money in the bank with all the programs that we run, for sure. So.
Director Leach.
Aye.
Director Jeffrey.
Aye.
Director Stanislav.
Aye.
Director Moran.
Aye.
Director Brown.
Aye.
Thank you.
Thank you.
Good. G2, we have some updated information about urgent cares. I'll turn that over to Rachel.
Okay, I'll just do a quick intro and then I'm going to turn it over to Judith. We know that we've had many conversations about urgent care in the far past and the relative recent past. So one of the things we thought we would do is try and figure out, if we were starting from scratch to bring an urgent care to the area, who would it be and what is the likelihood of that? Not considering the Med Plus urgent care as though that didn't exist and this was not done to compete. The idea was just to find out what in the market the interest would be for an urgent care. So this is where Judith did a tremendous amount of research. So you'll find a 2-page overview. But if you want to just kind of bullet point for that.
Yeah, I was gonna say the 2-page overview kind of gives you just an idea of what I did. So I was looking for an urgent care provider that had it was like a national chain so that they would have an incentive to come here. I was looking for somebody who had extended hours, like 7 a.m. to 9 p.m. at least. Someone who would offer lab tests and x-ray. So that was just the parameters that I was looking for originally. And then I reached out to different business development teams for several chains, but not everybody responded. So I spoke with about 5 of them. 3 of them were the most interested, and those are the ones you'll find in here. So American Family Care was the first one, and they have a franchise model urgent care where they would give us all the, the EHR for their system. They would give us the processes for licensing our own urgent care. They would evaluate the payer mix in the area for us and help us locate an area where we can place this urgent care. They did state that, they were looking for a $1.5 million initial investment, a $60,000 franchise fee, followed by a 7% royalty fee. They were interested in our area, but they were talking about the size of building that we needed and the payer mix that they were looking for. So as the conversations progressed, they were basically kind of dissuaded from the main central area of Fallbrook. They said they may be interested in something more close to 76. And they kind of left it there. Most of these said, we'll continue the conversations once I get back to them. But basically that's their parameters and what they said, that they did not find the main area of Fallbrook had the retail area that they were looking for primarily. Then I spoke with Carbon Health. They're more technology enabled healthcare, and interested in them because they had already done some partnerships with different healthcare entities. And they had one here at UC San Diego. They also have a lot of urgent care in Temecula, Escondido, San Marcos. So they have a strong footprint in North County. He actually stated that they had looked at Fallbrook. Their team had already looked in our direction. But their primary holdup is they don't feel that we have the population yet. They were very much saying that in about 3 to 5 years is when they would really have an interest in establishing an urgent care out here, unless we could provide some sort of financial incentives. And so that conversation went down the route of what can the district offer? Is there, a stepping method where as we become profitable, you guys can help us incur some of the losses so that we could provide the care to the population here until it becomes profitable for them. We went into building size and all that. So that's kind of where Carbon Health went.
Quick question. Do they have a number? Is it 3 to 5 years, 10% growth or 50% growth or 100%? I mean, what are they kind of thinking they need to get to in that time frame? And then we can figure out if that's even
3 to 5 years to become profitable is really kind of where we were leaving it at. There was no real hard numbers because I wasn't able to provide them a specific payer mix for our current population. They could invest their money into finding that information, but then they were looking for the partnership already to exist.
Yep.
So it was just a lot of conversations. I mean, we went in depth, we did cut up like the area, demographics, size. We went through Caltrans and obtained the daily average traffic volume on certain different streets to try to kind of help and assist, incentivize them to come to us. So we were sharing information, but there was nothing set in stone in regards to how profitable they would need to be. And then the last one that I had a really in-depth conversation with was Urgent Med. And they focus on basically like they prioritize convenience and efficiency. They're very their focus is getting patients in and out, having no wait time at their own in-house pharmacy. They said they had looked in our direction, were semi-interested. They went back and forth with their team and ended up saying, we truly not right now. They were the ones that said we probably have an interest in 5 to 7 years, if not a little longer. Because generally all of the conversations after we spent time with their teams and, me doing some research on this side, I also reached out to some rural health clinic providers and they all kind of shot me down saying, you're not really truly rural. You're very close to a lot of urban areas. They pulled out maps for me, so we didn't go anywhere with them. They were very helpful though, but they had no interest in bringing in any urgent cares here. Overall, the 3 main ones that I spoke with in depth were basically saying the same thing. Our district area does not have the patient volume to sustain a profitable urgent care clinic yet. 3 to 5 years, the other one said 5 to 7 years, depending on how we grow in that time frame. So
Judith, Could you identify if these providers you spoke to were based in the Riverside County area or in the San Diego area?
I
Because we have this 11-12 mile differential. And if you're in Riverside, they're gonna go, no.
I did talk to one in Riverside that was trying to grow into San Diego. But they said they were not ready to come into this specific area. They were eyeing more the Oceanside, Carlsbad area. So I started with national chains that have them throughout the United States who were very comfortable in different rural areas of the country, which may kind of look like us a little bit. So I started with that and I dwindled it down because some of them were just like, no, not interested whatsoever. The ones here were the ones that Carbon Health, I forget exactly where they're located, but they have a lot here. Urgent Med has a majority in the Orange County Riverside area coming into this area. And then the American Family Care is nationwide and they do some rural areas. And they were very interested at first, but once they figured out once they actually had their real estate team take a look at our, the main area of Fallbrook, they said the closest we had for what they called, their anchor, the retail anchor, tier 1 or tier 2, I think was the Dollar Tree. And they were looking for a building in that area. They honed in on there, couldn't find anything. We discussed this building, we discussed the wellness center, we're not trying to give it away, but we discussed like a variety of options. And where all of them were basically ending up was on the 76, all three of them ended up in the same area. On the 76, closest to the 15 as possible because of the annual average daily traffic they were looking for. And that's.
Isn't it crazy? Because the patients don't follow that mode of events to the urgent care. It can happen at any time, in any place in the North County area.
One of them was making a really good point. He said, you feel like you have the need right in your central area. He goes, but the volume of traffic and people, and, obviously I was leading it to them because they had studied this area, especially the one, I believe it was Carbon Health who had gone in depth before I even reached out to them. They said it's just not there yet. They said it's there. Obviously, the need exists in every community. But they felt strongly that, they had studied enough because he was saying, we've established Carlsbad, Oceanside, Vista. We are basically, back to back in our clinics. We had really in depth look at you guys, but they had looked closer to Bonsall.
Yeah,
And
there's a definite impact of the traffic volume from the freeway to Camp Hamilton at certain times of the day that can be absolutely an obstacle to overcome.
right, so unfortunately, all three of them kind of landed in the same place. Two of them were like, I'll call you back in about a year or two and see if there's anything else we can discuss. Do you have a building you can offer? Do you have financial incentives? All three of them also asked, without specifying it as well as Carbon Health, but like, what can you do to help us absorb losses to assist your community while it grows in population size?
And Judith and I then had the internal conversation, which puts us into the same conundrum we've had previously. Unless we're going to go into partnership, either our own, where we're funding it directly, that franchise model. These entities are for profit. And so that relationship of funding that wouldn't be able to work. So we wanted to gather this information, and Judith did a great job finding out the information from those business entities who are going to look for profitability. And they just gave us the information which we kept hearing from before, that there wasn't the right population, there wasn't the right population from a payer mix. So I will add on top of that, I've had a couple of other conversations with other providers that we already have currently in the community. So we're going to continue to investigate that and see what we can bring forward, but we just don't have any other information at this time other than what Judith was able to put together for us.
One second, I'll open up to public comment in just a second. I just wanted to say I appreciate the report. It was nice to look through the report and kind of see what I think some of us have been thinking. It's definitely an issue where people want to get into an urgent care and they want to have that available. I think a lot of us do for sure, but I don't think that I'll ever be in a place where I think that government money should go into businesses and subsidize them.
I
Their
agree.
loss,
Right.
you know, I mean, it's just not our role. I'm always looking for that conversation, and I appreciate staff continuing to look for that. Obviously, that's something that we'll continue to discuss. But you know, that's kind of where I'm at. I think where the board's at. Any public comments? Roy?
I'm assuming the current urgent care that's here is just staying the way it is. Is that correct? I mean, it's not leaving, is it?
No, it's not leaving. Again, to the point, we just wanted to gather as much information, because there has often been comments about, we need a 24-hour, we need an expanded hours, we need something else. And the market is showing that that just isn't sustainable.
Is there such a thing as a nonprofit urgent care?
Yes,
And is that something we've looked into yet, or?
yes.
Okay.
Yeah, I think we've had a number of discussions over the years, I believe, in talking to them over there about potentially doing it, but it was never something that was on their radar that they were interested in entertaining at all. So I think, like I said, I think we're always kind of open to that discussion. If something were to come along, I think some of the stuff that we're trying to do right now with like PACE and some of the clinical services over there is us trying to kind of fulfill that gap. So continue to look. Joe?
Yes, just I think the 7 to 9 hours are very, very good. Is that 7 days a week, hopefully? So well, let's see, Saturdays, the even month of the odd year that we're open. Is it across the board, 7 to 9, 7 days a week?
When I was looking, yeah, I was looking for across the board, Monday through, Sunday, just kind of.
Great.
Yeah.
Great, yeah, good. Try to do that because.
Well, and again,
Yeah.
those providers are not likely to show up anytime in the next 5 to 7 years. One of the things that we did do, the 2 urgent cares that are closest to us that have either 24 hours, which is in Temecula, or has expanded hours, which is the 8 to 8 model, is in Oceanside. Those are the 2 closest that offer that level of hours and service.
You know, I with regard to, actually I have 3 questions. First of all, to Jeff, would we have a non-compete issue with our building door? Number 2, when we talk about who's going to own this thing or manage it, is it the vision for the health district to own and operate this particular entity? And number 3, with regard to profitability, even nonprofits still make a profit. I don't care what you call it. It's called retained earnings, but you got to make more than what you spend to be the lights on. So if the guy next door is still open, he's obviously profitable in his current operating mode. So would we be able to replicate that and still have the ability to operate with an excess of revenue over expense, at least at some point in time? And by the way, Judith, I appreciate all the work that you put into this, because I can tell that you did. So
You're welcome.
Yeah.
questions I would
think-
have, especially to Jeff.
Yeah, I think, you always want to be sensitive to the competition issue. I mean, you don't want to run somebody who's in that business out of business in the community. So that's more of a political rather than a legal issue. Okay.
Yeah. Okay. Well, we should never.
That's-
With, our constituents.
Yeah, I mean, that's something that, that's something that the board has to wrestle with from a community and situation. So, we've had a number of physicians that had urgent care facilities in the community, but they've been for-profit type situations. And Bill is absolutely correct that we have to be very, very careful that the district doesn't support an urgent care center that's a for-profit center, because these are public dollars and there's very specific constitutional prohibitions with respect to allowing those dollars to flow to for-profit. So we've got to be really careful with that. What was your second question you'd asked, Terry, if you wouldn't mind going back?
Who's going to own and operate this entity? Is it going to be
Well,
in our name or something?
Yeah, I mean, basically, I think it's been the history for the district to not be in this business, okay, and directly in this type of business. Legally, you can get in this business. It's something that you can do if that's a priority of the board. But it's been more to try to support it's typical for districts to try to support organizations, nonprofit organizations that provide these community services. And, that way you've got skin in the game, so to speak, but you're not, you're not basically solely responsible. Sometimes they'll get, nonprofits will get federal dollars, state reimbursements. They get all kinds, there's ways that they can, as you say, they have to be profitable to be sustainable. And there's ways that they do that. And they can, you've got your federal qualified organizations that can provide these services, and districts do sometimes certainly help financially support those to make sure that those services are available to the community. So, I mean, and I think that sort of addresses your third issue, which was, nonprofits still have to they still have to have profitability or they can't sustain their existence.
Well, I certainly believe that if we can't operate a hospital, it would be appropriate to explore seriously the ability to support, operate, own, whatever urgent care center. I raised some questions about, are we competing with our constituents,
Right.
which is not something we should be doing, but it's a discussion we need to have continuing, in my opinion.
Yeah, and from a legal perspective, I can tell you, you have the authority to do that.
Okay.
Yeah, Ross, sure.
Did the first entity give a time frame for which they predict profitability? I
The
didn't.
first one, AFP, their franchise model, they thought also 3 to 5. Yeah, AFP and Carbon Health were both at 3 to 5. It was the last one that was 5 to 7.
Any questions from the board?
This is an ongoing concern that the community has had for as long as I've lived here, 23 years. And every one of the medical groups that we have providing services to our community members has a contract with specific providers, and they direct their patients to go there. If you were Medicare, I guess you could go anywhere. I would seriously consider doing a deep dive into working to develop a rural healthcare clinic or an urgent care for our district members, because it should be available. And if North County Fire is our partner with our MOU and they service this area and they're first responders, the first thing they do when they come out is an assessment and a triage. And we, appreciate what they do, but if they can't take you to the closest hospital, which because we are so close to Temecula, you're gonna get stuck going, where you don't want to go. Say you're a Kaiser patient or something like that. So it's always an issue about, the transportation part of it. What hospital do you go to? If you can triage and you can treat urgent care with stabilizing, diagnosing, laboratory and x-ray, and then a care plan, you can transition them back to their primary care or to have North County Fire take them to the appropriate hospital.
North County, keep in mind, North County Fire legally would not be able to take them to an urgent care property.
Right, okay,
They're not able to transport that, but a little bit to that and to follow up on a conversation I had with Mike. I've reached out to North County Fire to see if they could give us any kind of data on what kinds of cases, calls that they get could potentially have gone to urgent care instead of. So they're going to pull data on their basic life support
right,
ambulance as opposed to their advanced life support. In theory, most of those potentially, those calls could have gone to urgent care.
right.
So they're gonna provide me with some of that number. So this will be just part of our ongoing data gathering regarding that kind of level of care.
Yeah. It's, I believe it's a loss of consciousness, cardiac scenario, head injury. There's a couple others that warrant immediate assessment, and then you're in the queue to go to, they can contact the hospital and let them know that they've got this emergency, a true valid emergency coming in. And if you went to urgent care, you have the assessment and then you're treating it at a lower level of care. So you don't have that urgency, you're not tying up the unit and all the other manpower. It goes back to educating the community on first aid and then extreme first aid. And in the event that something happens, what do you do? And English and in Spanish. And if you give them the information, most people are capable of handling an emergency. Because we have families. If somebody goes down, the dog bites somebody breaks an arm, falls off, whatever. We deal with these things, and if they have the information available to them and can do these assessments and then contact their doctor and stay calm and focused, the idea is to make good decisions in a calm manner and hit the appropriate resources. Within that first 24 hours, you have a better chance of recovery from an incident. So
I think the data is being important in terms of, those two types of calls.
yeah,
What are the trends been? Are they up, down, sideways?
right.
And where do we expect to see them
Right.
grow? And what's the tipping point for which somebody gets excited about bringing an urgent care in?
Yeah, it's
That's
education.
really what it comes down
Yeah,
to.
it's education. It's just like calling 911 and then what's your emergency?
Roy? Did I hear correctly that it costs $1.5 million to run an urgent care?
$1.5 million initial investment with the franchise model. And then they wanted us to have $550,000 liquid assets, but that's just the entry into it.
For that particular franchise
That
model, that's
franchise.
what their cost is.
That's what their cost
The,
is.
the actual, if we were going to build and operate our own, that cost, we don't have that specific dollar, because that's not what we were researching, right?
I think the single most beneficial thing this group could do for the community would be to somehow either operate or own an urgent care that, even if it's only open during the wee hours when the other ones are closed, and it just filled in that gap, it would be tremendous what this group, the health district, would accomplish for this community.
You're here.
Yeah, it's the wee hours that things happen, 11 to 7, anything's possible.
Well, again, we're gathering that data from North County Fire, since they're the ones who receive the majority of those kinds of calls. We'll have to use their data the most. I can tell you, I had a follow-up conversation with Dr. Skio from Med Plus, and he very clearly indicated to me that the after 8 o'clock at night and before 8 o'clock in the morning is not when people are requiring urgent care services. Those are the hours people go to the emergency room because something big has happened. So again, now that is his data based on what he operates. But we'll continue to gather more information from North County Fire.
I would just And I think that when he turned in the data to us, the historical data was actually the opposite. It was he was getting a lot of people after hours and not as many during the daytime, no?
No, when he was reporting to us on extended hours.
Yeah.
When we were helping to support that, there was a bit more after the 4 to 6, 7 o'clock in the evening. There was a good chunk there. But where we saw some good interest was weekends.
Okay.
That Saturday time, not so much Sundays for some reason, but Saturdays. Again, we didn't have more than about 2 years worth of data on that. So it's hard to know.
Yeah.
Yeah, but when you do a lot of research on urgent cares, you find that 7 to 9 is the most popular time frames. Anything beyond that, a lot of the range of states, it's really not the hours that they maintain open because they see a majority kind of very much when you mentioned to me that that's what the doctor had said, I was like, oh, it matches very much with all the information I'm being provided by these national chains. They tend to do 7 to 9 because that's where they see the need. Anything beyond that, a couple of them did state, not the ones here, but they're like anything beyond that is usually emergency.
Yeah,
rooms
as
that-
far as in the middle of the night or something, right?
Yeah.
Yeah. Yeah, Jennifer. Sure.
So I'm very much looking forward to the data because the proof will be in the pudding. When we find out how many urgent careness is being served by North County, I'd also like the time frame. Can they do that?
I can ask. He is trying to pull the data based on where in the district they're also coming from. With the idea that it would help guide us from where the need is happening.
Right.
So I'll ask and see if she can gather any timeframes on that. as
Yeah,
well.
even if it could be AM, PM, or it doesn't have to be by the hour, but I think that would be important for us to know where the critical mass is during the 24-hour period. And that would help us know the market. I hate to use those terms, but it is all about density. It is all about quantity. Because you staff an urgent care, and if you get 3 people, you're still paying a ratio that's huge. And it can go up and down at any time. So that's why the large health districts health concerns like Graybill that is now associated with Palomar, they have one we just went to it this weekend, the one in Escondido, 27-minute drive. And then we got referred to the emergency room, so off we went there. So we've just got to have the data. We need the data.
And if I may add, that these managed care contracts that they have between the hospitals, the insurance company and the physicians, there's a responsibility matrix. And the dollars are allocated for urgent care services. And I would bet you dimes to dollars that it's on the physician's side. It's on the physician side instead of the hospital side. So the
I agree.
physician. Yeah, go ahead, Terry.
Yeah, I totally agree with that, Barbara. That's exactly how it would pan out.
And so if we could somehow work with our medical groups and in a collaboration of some way to help keep their costs down and maybe have clinical hours extended or whatever, it could be a win-win situation. But for the most part, they get paid per capitation per member per thousand per month. So they're not going to be motivated to do anything because they're keeping that money anyway. So the patient ends up jumping through hoops, and it's not just us, it's all over. The ERs are jammed, the urgent cares, you go in there and you gotta sit and get in the queue. And then you get referred out for your lab, you get referred out for your x-ray. And by the time you're having a hypertension episode because your blood pressure is going through the roof because you're so upset. And there's no kiosk there saying, please be patient, we are dealing with, emergency 1, 2, or 3. It's really a hot topic in this field because it is very, very needed, not just here, but all over. Somebody wants to put some money into a good venture, it would be to put strategic urgent cares that are not related to any managed care group. They're independent, that are community based and funded and oversight and whatever, and with the fire departments or first responders, police departments, etc., and keep the business end of it out of it. We're helping them keep the patients healthy.
Yeah, so yeah, I think that it's definitely a conversation we need to kind of continue to explore. I kind of agree with like what Roy was saying as far as the hours. Like, I don't think it would be something that I would be comfortable supporting, like 9 to 5, for example. I think that there's a lot of other options during those times. I think it's one of those things that we should probably kind of look outside the box a little bit. I think that whether it's maybe a nurse after hours or access to telehealth. I know, like for myself, I have Kaiser, and they have the urgent cares like all around that you can go to, but I haven't really had to go to one because every issue that we've had, we just do it either on the Zoom real quick to the doctor, just send a message and he calls in the prescription or whatever. So I think that, it's one of those things that we have to kind of look at technology as well, aside from just, putting a bunch of people in a building. But I would agree with Roy. I think that we, if we can address this issue and provide some services for the community, I mean, it would be a major impact. But at the end of the day, we have to watch the money and, what Judith mentioned, the $1.5 million to start and then potentially propping up a business for 5 years. I mean, who knows what that looks like. But yeah, I would welcome a continued discussion. Maybe we can brainstorm a little bit, send it back to strategic planning, maybe find some out of the box solutions, that we can look at, because I think that the board definitely has an inclination to want to support something like that. So.
Well, I think the franchise model, there are certainly case studies that they could present to us in terms of time to profitability, initial investment. What kind of density metrics are they looking at to drop them, where they are being dropped in the neighborhoods? And I definitely think from a strategic planning process, there's got to be a bullet there somewhere that says decision or process to urgent care coverage.
Yeah.
As a statement. Now, what are the actions under that drives us there by year?
Yeah.
So, because it may spread out over a couple of years, but I think there's core benchmarking we can do, then there's data that you can lay on that, and that determines your timing, your path and cost. So, yeah, I agree.
I'll take a couple more public comments here, Joe. Yeah.
Yes, just Roy's great comment, capitalizing on that. Out of the health districts that we have, this keeps coming up with Julie Reeder and the Village News and all, is about how many of the health districts in the state of California don't have a hospital. That always kind of comes up. How can we have a hospital district without a hospital? That's been answered very, very well. But how many do not have that? Because a district, to create a hospital district is not easy to do. And you'd think that the first priority is, just as Roy said, is the first priority is to have a facility somehow. Well, we had a facility here, and that didn't work out. Folks tried very, very hard. But what would you say the percentage of the health districts in California are similarly situated the way we are, that we don't really have a major facility here? What would you say? It's 1 out of 3? What is the percentage?
It's about maybe 20%.
Maybe
something like that.
20%
Yeah.
actually still have a hospital anymore.
Really, 20%?
Maybe, and we can go back and confirm that.
Right,
And most of those that still run their hospital
yeah,
are either in truly rural areas. So imagine Mono County,
Gotcha.
Mammoth, for example.
really isolated.
Very isolated. So Big Bear.
Right.
Tri-City and Palomar are unusual. Again, most of these districts are 50 to 70 years old. You're
Right.
not talking about districts that have been formed overnight.
Right,
Most are old. So you have a large mix that are these rural, or they really run their own hospital. You have
Gotcha.
quite a few that are like us, which are considered community-based and have a number of different services. To Jeff's point, we're authorized to do certain kinds. And then there's another group, which is more like the Grossmont Health District, where they have leased their hospital to a different operator, which is what this situation was with Fallbrook
right,
before the closure of. So
yeah,
those are the 3, but I can go back to ACHD and find out what that percentage looks like.
but it is pretty darn high. They don't have it. Interesting. So
Correct.
that's good.
Yeah, and you have to, if you look back at the history, a lot of it just comes from just an outdated model
Right.
coming out of World War II. You know, a lot of the hospitals were built based off of a community model where
Right.
it's funded by tax dollars, and
Before
nowadays
managed care.
it just doesn't happen anymore. So, you know, that's what kind of leads to a lot of the original hospital districts kind of moving to a little bit of a different model.
And it's wonderful to see that you have Tri-City, which is Carlsbad, Oceanside, Bull, Vista,
Uh-huh.
getting together, 3 cities working together to build one hospital, right on the borders of each one of the areas. It's fantastic. We don't seem to be very good at doing that now, although that's what LAFCO, I think, is trying to do, is to combine districts, you know, like FPUD and Rainbow. But
No,
that
that's
was
not-
shot down. So, just why we thought of it, but.
I'll just take one last comment. Ross, yeah.
I was just gonna say, so part of our monthly board packet is a breakdown by hour for our call volume. It's 8 to 8. Not the level at which Rachel mentioned, but our call volume is 8 to 8 primarily.
Yeah. Awesome. Great, we appreciate that. Okay, so, yeah, so we'll just send that back. We'll continue that discussion. If there's any updates for the board, just send them our way, and we'll kind of chew through those, and we'll continue to, you know, move that discussion along. Moving to G3, we've talked about our mission statement for a number of months now. We had a little bit of a lengthy discussion on it. And Director Stanisek gave us a good presentation about mission statements at the strategic planning workshop. So I'll turn it over to Director Stanisek, who's putting a lot of work on the you know, updated version and working through some of that. So.
Is the intent to go through that presentation
No,
or a summary of it?
You can just give a quick summary. I think that we
Yeah.
all had a chance to
I
go
thought,
through
yeah,
it.
okay, I want to make sure on the
So,
same page, so.
Any of the audience, if you'd like to go through it, feel free to check out our YouTube page.
Yeah. Yeah, some great time. So I have a lot of passion around mission, vision, values from past work and working with other companies, and how important it is to have good vision statements that lead to a good mission statement that leads to good support of the values that make it happen. So I've spent some time kind of walking through the historical documents we have. I came up with some ideas in terms of potential mission, vision, and values. They're still being fine-tuned and still something we're going to work through the strategic planning. But you know, we're going to tune it, take what we had and change it. So that's kind of where we are right now. I threw some ideas out on each one of those categories. Based on what I was hearing and what we've seen and talked about extensively with the staff as well as with the board. So we're working toward that and hope to get lined up here pretty soon.
And I was also gonna build on that. So we had an opportunity to meet with Director Stanisek and Jasmine as part of her onboarding. It may make sense to move this conversation, since we're redeveloping that whole communication strategy, to maybe move this conversation out of strategic planning for the development stage and kick it over to government and public engagement as one of their tasks. And then it can get kind of massaged and wordsmithed and work there. And then we can bring it back to the board for a little bit more of an overview if you're comfortable moving that task from previous to strategic planning to this.
No, I thought we were already good moving it over there.
That's fine.
I'm up for a motion if you.
It's just a task.
Yeah.
But I wanted to
No, I'm
make
saying
sure.
on a completed one. I'm not sure. if
Oh,
you
yeah,
want
on a
me, You're
completed-
ready to go, like, you know, but.
I think the next step is taking through it and pulling the elements that make sense and then align with the strategic plan, and then just start, you know, throwing darts at it and tuning it and getting ready
Okay.
and launch it. So that's
Excellent.
where my head is.
I agree with
Hopefully
that.
we can potentially have one that we could recommend
Yeah.
for the next board meeting.
Okay.
Hopefully.
Yeah.
Jennifer, did you
No,
have
that's,
something? Good. Public comments, Roy?
These are proposed, correct? The statements are.
Oh, yeah, these are working drafts.
So I'm just gonna play devil's advocate. The mission statement, to me, from a devil's advocate point of view, seems extremely weak. And the position is, so you're gonna take tax dollars to help me feel better or get healthier. And you're gonna get comments, I think, from people who are going to want to see something more concrete than that. And I'm just throwing this out, food for thought, when you do have more discussions, it's not enough return for the buck. I guess is what I'm saying. Just something to think about.
Any other public comments? No? Terry, do you have anything?
No, I'm good. I appreciate the work that we've already put into coming up with our vision and our mission statement, but I guess we could certainly go back and have a second look at it.
Yeah, sir, different than what I think we were.
Yeah, these are our
Yeah, let's be
current.
very clear on that. This is current, not where we're heading, because I don't recognize that.
Okay, then that does need to be changed then.
Yeah.
Okay, okay.
Yeah, so
I had to refresh myself. Wait a minute,
Yeah.
how to sync here.
It's obviously something that we looked at addressing, you know, it's definitely, I would say, having looked at it at a couple committee meetings, I mean, it's definitely tough to put in a succinct sort of pithy way and just say, hey, like, this is kind of what we do. But we're definitely working towards it, and I would agree. I mean, it's a lot of words that, you know, don't really get to the heart of it. So definitely agree on that. So I guess we'll send that to committee, hopefully take a look. We'll get a good one. Hopefully get you guys a good one here for the next meeting. And hopefully we can get something going, but it's definitely a big part of what we're looking to do, and especially a lot of the changes that have happened in the district over the last however many 5-6 years. It's definitely time to update that. So
Revamp.
Sir.
Yeah, what Roy was saying, you can end up adding on at the end of that, always looking into, in other words, the urgent care, that sort of thing, that will tend to beef it up. And it's there that, hey, this is something we may never attain that goal. But that is a goal, just what Roy is going. If anybody's got a pulse on what's going on in Bonsall, Rainbow, Fallbrook, Duluth, and beyond, it's Roy. So really, his comments are always very, very important.
Sure.
And that, I think, would beef it on up. Always looking into something like what Roy's desires are.
Yeah.
Something like that.
Thank you.
Thanks, Joe. Okay, moving on to G4. We've had a look at this proposal from Palomar Family Counseling a few times. And we'll go ahead and take another look here. Mitchell, do you have anything on this?
I don't have anything new. We reviewed it at the strategic planning workshop. Their director was able to answer some questions about primarily the cost, the fact that what they're charging and what they would be able to bill. Basically, this would allow them to just kind of break even. We're not talking about them making a lot of money. To be clear, they are a nonprofit partner. So it would bring mental health services to the community that anyone can come in regardless of insurance status or whomever they happen to have. With the main goal that this is a little bit more of a triage level. This is not for long-term, but to really help bridge folks before who may need services now, but can't get in to their therapist for 2-3 months. The idea is this could work to stabilize and to provide some immediate support so we can then serve to get them connected to other resources as well. So it's meant to be short-term solutions and then bridge these folks over into more long-term, more sustainable levels of care.
Director Jeffries?
I like the intent and the reason.
I don't know if this one's being put in.
Tom, put yourself on mute. I like the intent and the design, because so often people who are in crisis can't get to somebody. They go deeper into the well if they don't get some help immediately, and then it costs more if we just look at the cost. And so I like that very much, that it's a bridge. Refresh my memory. clients pay that $45 an hour?
No, that would be our expense. So the client's cost would be expected to be zero or whatever Palomar would be able to extract from insurance.
And this would be through an MOU
We would actually set up a contract MOU. for this,
contract,
yes.
like we do with the health district, with the fire district.
Exactly.
Okay, so this is a yearly expense of about 35 grand.
This is, yes.
Okay.
And then
This is like the pilot.
This is
to take
essentially a
look and
pilot,
See what
yeah.
they, see what sort of,
Response they
yeah,
get.
exactly.
Right.
And this is kind of in the same boat as urgent care.
Right.
Now, they have data that we don't have, which is backup and, the line, the queue that people are waiting to have services. So it would be interesting if we choose to go ahead. We'll know a lot more by the end of Q2. We will know some trends and that could be interesting. And would the Q1 be like starting in the school year or?
It could be whenever we would pull the trigger, basically, we would kind of start that. The idea of a graduated step up in the amount of hours really had to do with making sure that it's advertised. It takes a while for people to know that it's there. It allows Palomar to staff and build up based on demand.
And it will take a while for the word to get out. If you're really
It might
having,
not take as much time as we think.
well, true, but
yeah.
when you start getting 24 hours per week,
Right,
that will build up to that.
absolutely.
And as they go, because it's a new program.
Right.
So, okay,
And
thank you.
obviously, any contract language, we'd work with Jeff to basically have the board would have the opportunity to say the data is not showing that you need to have 2 therapists there. So let's bring this down. There's no point funding something that's not providing hours. So if it's not being utilized, I think we would want to have that ability to say, let's tear this back down.
Mhm.
Rachel, if you might answer this question for me, is Palomar Counseling affiliated with Palomar Health?
No,
No,
Just a name that they've chosen.
yeah, Palomar is just a very popular name around here.
Okay. Very
it's
good.
a mountain after all.
That's right.
Thank you. I know that clears a lot of things away. Thank you.
Any other questions here? Terry, you have anything?
Palomar Family Counseling, is it a nonprofit?
Yes, it is.
One of our partners.
Oh, so who owns it?
Nobody owns it because they are a nonprofit, so they're overseen by a board of directors,
Okay,
but they're
I-
not owned by anyone because they're an official 501c3.
I get,
Grants to them in the past, right?
Correct. Well, we have probably almost a 20-year grant history with them.
Right.
okay. All right. I'm good.
Yeah, so what my thoughts are basically, obviously, mental health is a big issue out there. It's a big component of healthcare these days. I think if you're paying attention to the news, I think we had 2 suicides in town just last week. So, I mean, I would say that it's definitely something that I would like to address. I like the idea that Rachel mentioned as far as if we're not getting the response by the second or third quarter, the ability to, I mean, at least bump it back down to
Adjust.
one, counselor, but I definitely, I would agree with the fact that the queue's long, likely, I see a lot of people around that likely have mental illness and, I think that the cost, what it is, isn't very much for the type of services that we're likely to provide. I also think that, any of the programs that are like this, where we're, obviously it's a good program, but we're basically training people that there's healthcare services over at the wellness center. I mean, if people are going there thinking mental health services, maybe in the future, the PACE program, different other clinical services that are potentially there, it kind of opens us up to when we figure out other programming, people are already going there, they're already thinking about it. So I would make the motion to approve the contract if we can get that language in it that, you know, it's fine to dial back. the numbers.
What I can do is, I'll work with Palomar Family Counseling and Jeff. We'll put together a full actual contract. Once Palomar Family Counseling is agreed, Jeff has the right language, we'll bring it back to the board for a final vote. But I didn't obviously want to pursue it if you all were at least comfortable with this initial set of terms.
So, you got a motion?
Do you need a motion to proceed?
I think we should, yes.
I second that motion.
Any further discussion?
I just add that I think for me, it's always about test, learn and decide. So this is a good way to
Good
test and
test.
learn and decide. So I fully support that. I think it's great market research.
Just put something in conflict resolution within the contract arrangement so that you can have a bridge to problem solve.
Jeff always has good language in that part. So I'm not gonna worry about that, Jeff. You'll build in that language.
Yep.
Okay.
Yep. Okay.
Excuse me.
Good stuff.
Do we do?
Oh, no, I got a weird tickle in my throat. Director Leach,
Aye.
Director Jeffries.
Aye.
Director Stanica.
Aye.
Director Morales,
Aye.
Director Brown.
Aye.
Thank you. All right, perfect.
All right, and I'll obviously bring that forward once I have a little more information, but I'll contact Palomar soon. I know they're excited.
Good deal. So we'll go ahead and move on to G5. It's the LAFCO ballot extension, San Diego County Consolidated Redevelopment Oversight Board.
How's that for a title?
Glad I'm not on that one.
So this was sent to us, obviously by LAFCO. G6 is information for Municipal Water District of Orange County, their pledge of support for Al Niederhood. So it is essentially a ballot, and it is up for the board to decide if you would like to go ahead and make a vote or a nomination.
Okay, do we have a motion?
So you can,
Why isn't Al on there? I'm not understanding.
This is the first one.
And it's asking our support for whom?
they're not two separate, are they?
They're two separate.
Oh, they're two
Yes,
separate.
I
Oh,
got
I'm
it.
sorry.
Next one for CSDA.
Yes,
right?
this is the first one.
Okay, and is this just is it an announcement or are they recommending something? Is LAFCO telling us?
So they're looking for a member to
Right.
sit on this oversight board. So they have two nominees,
And
Kim Rubles and
okay.
Patrick Sanchez.
So,
I
and so
added
we
this.
don't have anybody saying, please vote for this person.
Correct.
Okay. So, I'll make a observation.
Sure.
Okay. I always like to have near and dear, and Vista is nearer to us than Lakeside.
Mhm.
So that's an odd geography bent I have. Because I don't know these two people.
Sure. Anything else? Any public comments?
I was just gonna say, they didn't get enough votes last time, so they're sending it back because they couldn't certify the election. So that's what it is.
Is it a percentage of votes that they need? Is it a majority?
They have to
or-
have a majority of districts participating,
Understood.
and they didn't get enough people to participate, so they sent back to the special districts. Not all of the special districts locally are even involved in this.
Yeah.
So we could be voting on something like, for example, in North County Fire, when we did this, we don't participate, we don't see any benefit, but we still send out a ballot.
Okay. And if I may make a motion,
Absolutely.
I make a motion to vote for Patrick Sanchez.
We have a second? I'll second.
Okay.
Any discussion? I like the local.
I like local.
Director Morales,
Aye.
Director Stanica.
Aye.
Director Jeffries.
Aye.
Director Leach.
Aye.
Director Brown.
Aye.
Thank you.
Sorry, I didn't mean to confuse that issue. That was.
Yeah, it was the two separate ones.
Carrying.
They got together. Okay,
Okay,
Here's the next one.
yeah, fine. So, P6, municipal water district of Orange County. This one is the support for Al Netterhood for, CSDA Board of Directors, Southern Seat, C.
Yeah.
So this is, this is obviously, this is for the board for CSDA, the trade group that, represents special districts. So, anything else on that?
No, I'm not, keep my mouth shut on this.
Do you have any public comments? No, sir?
I just think it's wise that, in listening to LAFCO and all, that so many within government, do not take a stand. And it's, even if sometimes you take the wrong stand, it's good to make a stand. Yeah, under the totality of circumstances, what's the best decision to do and make that? Whereas at LAFCO, we're down there with the Rainbow Municipal Water District and whatever, and LAFCO was asking about, well, what kind of support are we getting from this? And folks are just too hot to handle. Sandag, did Sandag recommend it? They just go right, no. And so it would be nice here, as you all, to make a decision, even if folks don't like it, through Julie Reader's letters to the editor and all that sort of thing, that at least you're making a decision. And that I think is important and shows being courageous.
Well, I appreciate that, Joe. I'm gonna go ahead and make a stand right here now then. I'm gonna make a motion to support Al Netterhood to the CSDA Board of Directors.
I'll second that.
Any discussion?
He seems very well qualified.
Okay, well, hopefully we'll hear from Julie Reader.
Director Leach,
Aye.
Director Jeffrey.
Aye.
Director Stansett.
Aye.
Director Mraz.
Aye.
Director Brown.
Aye.
Okay, so do we have any board member comments or any items for subsequent meetings? I just I just have one comment. I just wanted to recognize that today's Flag Day. So just wanted to kind of put it out there, it's definitely something that we should think about, the country's pretty divided and, it's a good day for us to kind of, look within and, remember that we're all Americans.
That's
So,
right.
It doesn't even hold a candle to the Vietnam era, though.
That's right.
We're a lot more united than we were during the Vietnam era.
Okay, all right.
So,
That's good to hear for sure.
yeah.
Hey, Bill. I just wanted to give an update. There were 76 healthcare districts were created. 54 serve the state's rural areas. 38 of the 76 no longer operate hospitals.
Wow.
Yeah.
Thanks, Jeff. I appreciate that.
Yeah.
I know everyone will be on the number two. So.
Yeah, well, I think very impressive on the front page or something. So let's see, do we have any other staff items, anything else? No?
Just acknowledge the schedule, the fact that the facilities committee, just as a reminder, that moved from a afternoon meeting to a morning meeting. And then the fact that strategic planning this month won't happen. Instead, we'll have our community youth fitness grants meeting
Awesome.
on that time.
So yeah, so that's definitely something that I'm definitely looking forward to. We've had a lot of discussion about it and the benefits of supporting youth in our community and getting them out there and promoting physical fitness. So definitely looking forward to that. And then we have a couple other future calendar items if you guys want to attend. Other than that, I'll go ahead and adjourn the meeting.
Great.
All right.
Thank you.